So today we're using our Shockwave machine, which is really incredible technology, which takes compressed air and sound waves and transforms it into a radial pressure wave, which puts pressure through the body about 4 to 5 centimeters deep at times, and is great for dealing with acute and chronic pain. It's great for healing tendinopathies. It's great for breaking up scar tissue. It's great for breaking up calcified tissue. What it's really doing in the body is it's taking and it's stimulating the body's natural healing response so that it releases growth factor and it actually heals damaged tissue. When we use it, if you put it at the right settings, it doesn't really hurt. It's not supposed to hurt. And when we're moving it around on a person's body, a lot of times they'll report that it feels about a 3 or 4 out of 10, with 10 being painful. And then when we get to an area where there's some damaged tissue, it might be a little higher on that scale, maybe a 5 or a 6 or so. We typically use it for a few minutes at a time. And again, it's not a painful therapy. Do it about 6 sessions and it is transformative in how patients report feeling better, healing so much faster and better. And I just love Shockwave therapy, and I want everyone to experience it. Shockwave is being used for a whole sort of things currently, plus there's research on many other areas. We're using it for lower back pain. We're using it for neck pain, shoulder pain. We're using it for arthritic conditions. We're using it for torn menisces. We're using it for plantar fasciitis and partially torn Achilles tendons. It's great for ligament repair, tendon repair. Again, I mentioned arthritis. There's really nothing out there that helps people with any arthritic pain caused by extra calcium deposits in their joints. So people with swollen and painful fingers, we're using this on their hands and their fingers, and it seems to be doing great stuff. There are other offices that are using this for things like cellulite reduction. So we're gonna do some lower back treatment very quickly here. I've prepared the area, got some paper on here. We don't wanna get the clothes damaged with any cream or lotion. We're gonna put a little bit of cold lotion on. Now I'm gonna turn this machine on in a moment, and it might be a bit loud, but the machine is delivering pulses of compressed air and sound waves, but the patient is going to interpret it as electrical impulses. With the energy turned so low, it should not be painful, but we definitely want you to feel it. And if we do get to an area where there is some damaged tissue, a lot of times at that point, the patient might feel it a little stronger. Okay, so do let me know what you feel while we're doing this, okay? So I'm gonna turn the machine on, we're gonna press start, and here we go. How's that feel?
Good.
You could hold this machine in one spot for a while if you wanted, or move it around as I am to get a broader area. There are many different transducers or heads that can be swapped out on this machine depending on what part of the body we're doing and what the type of injured tissue is that we're working on. You okay?
Yeah, amazing.
What does it feel like?
It feels like little electric wave.
That's it. But not painful.
No, it's very good. Relaxing.
Like on a scale of 1 to 10, with 10 being the most painful, what would you describe this as?
I think 5.
Okay. So a 4 or a 5 is the right response. We're looking for you to feel it like a 4 or a 5. But sometimes we'll hit a patch of injured tissue and then you might have it at a slightly higher number.